Perimenopause actually can start when you're in your 30s with small changes in your hormone levels, but it can really manifest externally through symptoms that are not fun.
Welcome to the Ultra Healthy Now podcast, where your journey to feeling younger, sexier, and more energized begins. Dr. Nicole Srednicki, who specializes in high-performance health, will dive into practical, actionable tips and strategies that can transform your physical, mental, and emotional well-being. Join us as we uncover the secrets to living a healthier, happier life, mind, body, and spirit. Because true health, beauty, and happiness start on the inside.
Hi, everyone. Today's show is especially important for all the women listening today. So if you're not one, feel free to skip this one or send it to a loved one. This is especially important for all the women in their 30s or 40s because you might be wondering, are you in perimenopause? Today, we're going to be discussing how this can impact your energy levels, the early signs of perimenopause, and what you can do to avoid these miserable symptoms and avoid accelerated aging, because none of us want to feel this way. So welcome to Ultra Healthy Human, and we're part of the Rich Dad Network. I'm your host, Alexandra Gonzalez, with Dr. Nicole Srednicki. Dr. Srednicki, perimenopause can really impact the energy and the well-being of so many of our entrepreneurial women and investors. How have you seen this impact your patients? Because I know so many of your patients are a part of this world of entrepreneurs and investors.
Yeah. So patients come to me with sometimes symptoms that they don't understand, or if there are men listening in, their girlfriend or their mom or their wife are kind of acting differently, or they just kind of feel out of sorts, and sometimes they can't identify what they're feeling. Sometimes these can be signs of what's called perimenopause, which is like that transitional phase that happens before menopause. And it can be very subtle symptoms to start with. That's why I thought it was important that we have this episode, because we have so many young entrepreneurs, women that are in their late 30s, early 40s. Perimenopause actually can start when you're in your 30s with small changes in your hormone levels, but it can really manifest externally through symptoms that are not fun and cause accelerated aging, things like wrinkles and, the things on the outside we also don't want to see. So I want to share a story about one of my patients who I actually saw last week. We were at televisit. Her name's Julie, and she okayed me talking about her. She lives in Texas. She's 43. She lives a very active lifestyle. She is an entrepreneur, a mother, and a wife. And she's beautiful inside and out. And I love her accent. During our call, she was telling me that she's been having some episodes of low energy on most days. She sleeps well, but she wakes up early sometimes. And she's very disciplined. She exercises daily, and she does her 21-day ultra healthy detox twice a year to keep her diet in check. Mm-hmm. When I first started seeing her a while ago, she was also complaining of intermittent fatigue, but we resolved that when she first started doing the detox. But now it's back. She feels like it's more often. And so, typically she's doing a good job of keeping her diet regimented. She's drinking enough water, but she also admits to feeling a lot of stress with running her company. Her periods are so regular, and she denies any hot flashes, and occasionally she's irritable. So Julie isn't alone here. There's many people out there, many other people that tell me, or maybe you might be feeling it. Not you, Alex. I know you're still in your 20s, but I wanted to share with people today how to be able to recognize some of these symptoms, and how these hormones changes can impact your life and what you can do about it. So here it is. If you feel low energy, if you feel subtle symptoms, like maybe even body temperature changes, if you're feeling hot at night, or you're feeling more irritable, or you're feeling brain fog, having weight gain, and not just during those PMS times, right before your period, maybe like these PMS symptoms are lasting longer. So you may be experiencing what Julie was experiencing, and this can be related to your hormones. The interesting part of this too is this is not just for women. Men actually experience hormone changes too, and that's called andropause. But we're going to talk about men hormones on another podcast. So in Julie's case, her labs came back normal except for her hormones. They were not considered clinically low, meaning if she went to her regular doctor, they'd be like, oh, you're fine. But from the anti-aging perspective, they were not optimized. So I recommended for her that we start what's called BHRT, estrogen, testosterone cream, and oral progesterone. So the first thing she asked me was, what does BHRT mean? And that stands for Bioidentical Hormone Replacement Therapy, which typically uses hormones that are chemically identical and more natural to those produced by your body versus synthetic, which are said to be made from horse urine. Think of it like that game you used to play when you were a child and you had to fit shapes into certain cutouts. So you had to fit the square into the square hole. That's like BHRT. But when you're trying to fit the circle into the square hole, that's not going to fit right. And that's basically like synthetic. So basically, BHRT is more tailored to your body, whereas synthetic is not. So in my opinion, BHRT is safer than traditional synthetic hormone replacement therapy or HRT. And it's important to note that both are forms of hormone replacement. So next thing Julie asked me was like, why are we using like some cream and why are you using some as pills? So studies have shown that cream is absorbed really well. And therefore when we absorb it through our skin, it's bypassing that liver breakdown process. So it allows our body to utilize it better. And it also makes it safer because being absorbed through the skin versus being bypassed through the liver can actually dictate which hormone pathway your body chooses. So health risks have actually been seen when people are using oral estrogen and testosterone. It's kind of an old way of practice, but oral progesterone has shown to be safe. And so that's why we can use the pill form of estrogen, but I like to use the cream form of estrogen and testosterone. The next thing she asked me was, why do I have to use all of these? And what I say is we want to balance all the hormones because it's like a symphony. So they all need to play together to have the best harmony.
And Nicole, so, when you're talking about the oral and the topical, would you recommend first the topical approach and then the oral, or are there certain cases where you would just completely refuse the oral form of it?
So that's a good question. So when you take estrogen and progesterone and testosterone, like let's say you're taking them all. So there's different methods. There is topical, there is a pill that you swallow. There's something called a troche that goes under your tongue to be absorbed. There's also pellets. I'm a huge fan of pellets because when you get a pellet, it's implanted underneath your skin. So, there can be a little bit of risk of infection there, low risks, but it gives you basically a blast of hormone. Now they are the way they make them, they are supposed to slowly disperse. But overall, you get this blast of hormone. And when I look at people's blood work, I see, women's testosterone sometimes up at a man's level, which in my opinion is not so safe. So doing the pellets, I don't think is the best choice. Also because you're constantly going up and down. So every few months, you're dropping down. So slowly you're just feeling like blah again. And then you have to get that blast again versus a topical, you're going to get that steady state because you're just applying it topically. With troches are, I think they're a little bit better than the pill form because when you're taking a pill, it's going straight into your gut, then through your liver. We really don't want these hormones going through your liver because that's when they can metabolize them kind of abnormally. Troche is good because it's still an absorption method. However, when you have that under your tongue, you're still kind of like swallowing and you still end up with a little bit of it through your liver. And I can usually point out on, when I see somebody that has come to me from maybe another clinic, when I look at their labs, I'll say, are you taking troches, because I can see it. Sometimes that bad estrogen or bad testosterone is a little higher than where it should be.
Yeah, and I obviously I can imagine Julie asking all these questions because I've also heard that hormones can cause breast cancer. And so can you shed some light onto this topic?
Yeah, that's a great question. And the answer is yes and no. So remember, BHRT and synthetic hormones are different. It depends what type of hormone you're using. So in the Women's Health Initiative, this is like massive studies, very well known. In one of their major studies, or several of them, when they looked at all the data, it showed that traditional synthetic hormone replacement therapy, particularly combined with progestin and estrogen therapy, was associated with increased breast cancer risk. That's why at Ultra Healthy Human, I don't prescribe synthetic hormones. I really don't think they are in the best interest of the patient. Research suggests that BHRT, particularly when used with progesterone rather than synthetic progestins, may be safer. In 2017, a study found that BHRT was not associated with an increased risk of breast cancer when compared to synthetic HRT. However, it's also emphasized that the quality and consistency of BHRT can vary, which may impact the outcomes. And this basically means when you get BHRT, it's usually coming from a compound pharmacy, and they're more specialty. So they're making dose after dose after dose. And so sometimes there can be variation. So just make sure that whatever doctor is prescribing for you is using a reputable compounding pharmacy. So in essence, there's potentially a lower risk of breast cancer when you're using BHRT, but evidence is still evolving. And it's crucial when considering BHRT to consult a doctor who uses the most current research and guidelines, because this is always changing and they're always, either getting positive data or, sometimes there's negatives that can impact, what type you're using and the form that you're using as well. So, yep, go ahead.
No, no. And I can imagine too, like, for example, if you have a relative like in your history that's had breast cancer, does that increase the chances once you're taking the hormones?
So that's another great question. We always want to weigh out the risks versus benefits. So we talk about personal history, we talk about family history, we talk a little bit about genetics, and those definitely can impact risk factors. So that's actually what I did with Julie. That was kind of our next step. We weighed out those benefits versus risks, and we decided, we made a decision together. And she decided that she would want to take the bioidentical hormone replacement therapy, which is BHRT.
Yeah. And of course, the topic of hormones can be very intimidating, right? Like I come from a Hispanic family and we choose to go to the natural route so many ways, right? And I feel like it can be intimidating for people entering, this perimenopause or that just maybe don't want to admit it. Are there risks to when you choose not to go on hormone replacement therapy? Or also, are there risks associated with having these low hormone levels?
Yeah, that's another awesome question, because I've also had patients come to me and I'll tell them like your hormones are low. And that might be correlating with some of your symptoms. And they're like, well, I'll just get through it. I don't want to take hormones because, I've heard all of this bad stuff about it. But what some people don't know is low hormones will not only give you negative symptoms, but they can also be unhealthy for your body. So when you have low hormones, it can lead to weight gain. It can cause your blood pressure to go up. It can increase risks of stroke. It can increase risks of bone loss, insulin resistance. So, thinking that hormone replacement is bad is a misunderstanding. Remember, hormones need to be balanced. They shouldn't be too low or too high. Think about when you were a teenager and you felt vibrant, energized, and you had a libido. You're so young, you're still in that phase. So for others, like HRT can help you feel, BHRT can help you feel more like you did in your younger years, having more mental clarity, feelings of well-being, the ability to gain muscle and having that good mood. And now that we understand why this is important, just remember that there are different health benefits and risks between BHRT, and the synthetic HRT.
hmm And
Uh,
Nicole, it's funny that you mentioned like obviously the age aspect, right? Because there's statistically the age range that you experience the perimenopause, right? But some of the symptoms you talked about, I even hear some of my friends complain about where I'm sluggish and I'm tired and I can't sleep and I wake up with night sweats and I'm overweight and I can't lose weight and maybe it's my thyroid, blah, 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 right? So, how do you realize the difference? I guess if it is perimenopause or if it's these symptoms that maybe those people who don't do their detox and don't have a doctor like you experience.
So we always want to see, what's going on internally, right? We want to assess blood work. And we like to do very comprehensive blood work so we can really like narrow in on what exactly is the cause, but also simple things like looking at your lifestyle. Like let's say you're not ready, you don't want to go to the doctor yet. And you want to figure out, could this be like perimenopause? Look at your lifestyle first. Look at your diet. Sometimes, like when you just have a bad diet or you're dehydrated or you're stressed, it will throw your body off and could mimic similar symptoms. So, make sure that that's why I mentioned that Julie has already gone through, doing her detoxes and she really balanced out a lot of things within her life. But then we still noticed that these were creeping in. And then you can also solidify it with that blood work. So we look at a whole like hormone panel that looks at how much estrogen is in your body, how much good estrogen, how much bad estrogen, how much testosterone, how much good and bad, and then how much progesterone, and then looking at cortisol levels and other sex hormones that can influence these hormones. So sometimes it's also, we need to get stress under control, and sometimes your body can then rebalance those hormones. So you might not just have to go to bioidentical hormone replacement therapy.
Yeah. And I really admire Julie, or maybe even anyone listening to us that has a business, is an investor, is a mom, and handles so many other aspects and is juggling all of this while experiencing symptoms like this. I feel like as women, we typically go through so much throughout our body and throughout our life. And so, in order to be obviously as entrepreneurs, we need to be in our peak state. We need to be high performing. So, is there a way we can delay this process or ease the symptoms so we can be in this, peak state that we need to be in every day?
Yeah. So, okay. So, like I mentioned with Julie, like her labs in like traditional medicine weren't like in the red, right? They weren't super low. So I could see that there were subtle things that were off. And so sometimes when you can fix issues then, so with her, because she's also in her 40s, right? She's not like, she's done having kids. She's not like young, where we're going to maybe do other things to try to like kickstart her hormones again. We're like, okay, we're at the phase with her where it's like they're just slowly dwindling. So her body needs that extra boost. And so starting them when they're suboptimal will ease that transition and make that phase of when she does go through menopause, like she won't experience those typically, won't experience those extreme symptoms. And again, then it's safer for your body. So she's not allowing her body to like these hormones to dwindle down. And then her body's like, your body struggles when you have no hormones. And so just making it like a steady transition is really helping her. And I actually just had a follow up with her after starting her BHRT, and she said she's already feeling such a difference. She's feeling more energized. She said she has a better attitude, and then she's like going right to sleep because of the progesterone. And so I'm so excited to already hear this because, as I mentioned earlier, she's an entrepreneur, she's a mother, like she is on the go all the time and needs to be at peak performance. And so this helped to get her back to her norm of feeling her best.
Oh, that's amazing to hear. So happy for Julie. And you mentioned earlier too that there is it can be dangerous to also have like high levels of testosterone and stuff. Can you walk us through some of the side effects of how testosterone can play in our lives?
Yeah, that was actually one of Julie's questions because when I was telling her about this, she was like "Dr. Nicole, like some of my friends talk like men now, like their voices are so deep." And I was like, "Oh my God." I was like, "Are they getting pellets?" And she was like, oh, yes, they talk about that. So kind of going back to what I was saying before with pellets, you get this blast of hormone. And I have women that will come into me and they have hormone levels of a man. Like that is not, in my opinion, is not the safest thing for your body. And then their voices start to get deeper. They start to get abnormal hair growth like on their face and other areas of their body. And then they can become more aggressive or more irritable. So, women need testosterone, absolutely, but you need to be safe with it. And there are pellets that won't, you want to be careful too, like who is prescribing this for you and that they're guiding you correctly. Like just because, you're feeling great and energized, but if there's a lot of other things going on that can be harmful to your body, like you should have all of this education so that you can make the best decision.
Yeah. And just out of curiosity, we talked about like the negative effects of having like too much testosterone. I also know, women around my age that will try and lower their testosterone, or what are some of the symptoms of one, having low testosterone, and two, is there something dangerous about having those low levels as well?
Sure. So yeah, I have seen this as well. And young girls sometimes they're like, why do I have no libido? And now part of that could be stress. It could be factors around, your relationship. But sometimes when I look at hormone levels, we will see low testosterone levels. And in cases like that, where they want to like boost up their libido, we might actually use like some vaginal testosterone because that's then delivered to more of like the local area versus like getting systemic effects. And then it can just help boost up the libido in a pretty safe way because it's a very low dose. And so sometimes that's all they need. But of course, looking at it as like a whole body perspective, I don't want to ignore the fact if they're super stressed out and that's what's driving their libido down. We don't want to just band-aid it. We want to work on the whole picture.
Yeah, amazing. And I can imagine also that like having that low testosterone will affect, like, for example, your fatigue or energy levels. So, but like you were mentioning, obviously no extreme is good. And it's important to find a doctor that will assess the entire situation and not just try and fix one issue. Because I think that's where so many other issues will start to arise.
Yeah, exactly.
Yeah. And Dr. Nicole, thank you so much for shedding light on the perimenopause. For all the women that are in their 30s or 40s, or like you even mentioned, men that can experience these hormone changes in their life because our body goes through cycles. Thank you, because I know there's so many entrepreneurs out there that need this information in order to take action. And so do you have any final words for our audience?
I think, if anybody is experiencing symptoms like Julie or some of the other things I mentioned, go get it checked out, assess it now. Don't wait till it gets like unbearable and make sure you're seeking out somebody who really is well versed in that area, has the latest knowledge and can help give you all the information so that you can make the best decision for you.
Yeah. And definitely, if you're feeling tired, don't avoid it. I feel like we think it's such a small symptom compared to, these extreme symptoms we see. And I think it's a very important one because it affects your day to day. It affects how you feel about yourself. It affects how you act with your loved ones. So take action now. And, if you want to set up a call with Dr. Nicole Srednicki or a consult to be able to assess what you're feeling or, internally what's going on with you and how you can be a better wife, entrepreneur, investor, schedule a call. We'll leave the link below. And she works with everybody worldwide. So you can, book an appointment, a teledoc appointment, and get all your problems solved. Thank you so much for Dr. Nicole Srednicki for shedding light on this important topic. And please like and subscribe this video if you enjoyed it. Let us know below in the comments what other topics you'd like Dr. Nicole to uncover.
Thank you for tuning in to the Ultra Healthy Now podcast with Dr. Nicole Srednicki. To discover more, visit ultrahealthynow.com and jumpstart your wellness journey with our 21-day detox program, a total body reset, more energy, better focus, and weight reduction. Our carefully formulated, high-quality supplements will aid in a new level of wellness. Don't wait. Unleash the ultra healthy human within you. At Ultra Healthy Human, Eastern and Western modalities are combined with cutting-edge technology to guide personalized health programs to help you tap into the limitless potential of your mind and body. Because true health, beauty, and happiness start from within. Remember to subscribe, like, and share this episode wherever you listen to podcasts.
And before we sign off, I want to make it crystal clear that the information presented here is for informational and entertainment purposes only. This episode should not be considered a substitute for professional medical advice, diagnosis, or treatment. And while we strive to provide accurate and up-to-date information, the content discussed in this podcast is based on general knowledge and research available at the time of recording. Medical knowledge and guidelines can evolve, and what we discussed may not always reflect the most current research or recommendations. If you have specific health concerns or questions, we strongly encourage you to consult with a qualified healthcare professional or medical specialist who can provide personalized advice tailored to your unique circumstances. Every individual's health situation is unique, and what works for one person may not be suitable for another.
This podcast is a presentation of the Rich Dad Media Network.